Hi, I'm Susan Taylor with Scripps Health in San Diego, California. When you think about a heart attack, what comes to mind? Pain in the chest, shortness of breath? What about indigestion or pain in the jaw? Because heart attack symptoms can be very different in men and women. Joining us to talk about heart attack symptoms and treatment is Dr. Poulina Uddin. She is a cardiologist with Scripps Clinic in La Jolla, California. Thanks so much for being with us, doctor.
Thank you for having me.
Sure. All right, so let's start with the basics. Let's talk about the heart attack symptoms in men and women.
So most people are familiar with what we think are heart attack symptoms. Somebody obviously having chest pain or trouble breathing. Those are usually big signs of heart attack. And those can happen. Those are very commonly described in men. They actually do happen in women as well. But what we have learned lately is that women also tend to have more vague and what we call atypical symptoms. So they may or may not experience the chest pain or shortness of breath, but oftentimes will complain of back pain, jaw or neck pain, fatigue, nausea, or even belly pain. So sometimes the symptoms can be a little more tricky to tease out in women compared to men.
And why are they different? These symptoms different between men and women?
That's a great question. It's actually still being studied. We think it's probably a combination of factors. There are slight differences in the anatomy of women's physiology compared to men. For example, vessels of the heart are actually smaller. The distribution of cholesterol can be different in the vessels. And then, of course, we all know that women are subject to a wide variety and fluctuations of hormones that can cause some vascular changes as well. And so we think that these factors all contribute to the varied presentation of symptoms in women compared to men.
All right, so if you have these symptoms, what should you do?
So what I tell my patients, or what I would like anyone to know, is if you have any new or worrisome symptoms, something that is definitely new, a change, chest pain, trouble breathing, something that's interrupting what you're doing during the day, definitely may be worth an emergency room visit or even a call to 911, depending on how dramatic or severe those symptoms are. If the symptoms are something that's perhaps been going on longer, intermittent, a little less bothersome, I do still think they require attention. And that's something where I would call your physician, try to set up an appointment to review and see if any further testing needs to be done.
So who is at risk for having a heart attack?
Well, unfortunately, everyone is at risk for having a heart attack. And the reason for that is there are actually several different types of heart attack, which people may not realize. And some are quite preventable through the things that we know, appropriate diet, keeping your cholesterol low, watching your blood pressure, avoiding smoking. And that's what the bulk of heart attacks actually come from. Unfortunately, there are other types of heart attacks that are what we call bad luck, where sometimes you can suddenly get a plaque rupture, or actually the artery can tear, and they're varied presentations. Some are more common in women, some are more common in men, some are actually more common in younger versus older patients. And so unfortunately, anybody can be at risk for a heart attack, and we certainly know that people with certain risk factors, family history, tend to be at higher risk.
According to the CDC, the Centers for Disease Control and Prevention, heart disease is the leading cause of death for both men and women in the US. Why is that?
So that's a great question. I think part of the reason is, as I said, most heart attacks are those classic type that are related to those risk factors of obesity, diabetes, smoking, high cholesterol, and those tend to also go with more of an aging population as we have. Women actually live longer than men, which then puts them even at increased risk. And I think what's important to realize is that, as we mentioned before, everyone unfortunately is at risk for cardiovascular disease. Sometimes people don't realize that women's risk is just as high, and in some instances, even higher than men, depending on, again, their family history, whether they're menopausal, what types of complications they had during their pregnancies. So the risk has actually always been there. Usually it's just overshadowed by other perceived more important things or things that are going on in people's daily lives. And so the risk has always been high. I just think, unfortunately, sometimes it's on the back burner because there's so many other things to think about.
So how do you reduce your risk for getting a heart attack?
So fortunately, most of the things that you can do to reduce your risk of heart disease or heart attack is actually something you can do on your own. And they're things that we have been saying forever. It's really appropriate exercise, at least 3 to 5 times a week for a minimum of 30 to 40 minutes a day of cardiovascular exercise, meaning getting your heart rate up, getting off the couch, sweating a little bit, getting a little uncomfortable so that you're huffing and puffing. And then it really comes down to diet as well. I mean, I think we all know those things that are delicious, maybe that we shouldn't eat or can only eat once in a while, versus the things that you should be eating every day, fruits, veggies, trying to avoid highly processed foods. And those are certainly have a huge impact on reducing the risk of cardiovascular disease down the road. Diet and exercise bring down the cholesterol, they reduce inflammation, they help keep the blood pressure under control, and of course, most importantly, avoiding obesity, which is one of our biggest risk factors. And, we actually have some great ways to help patients with that. If they feel that they can't do it on their own, we've got our cardiac rehab program, we've got our nutritionist here. So some people are really motivated and you can certainly do it on your own, but if you feel like you need a little help, we've got programs here for that as well to reduce risk.
So when should you start paying attention to your heart?
That's a great question. I will actually tell people you should start paying attention even from childhood. If there's a strong family history, even as early as your teen years, young adolescent years, where those habits develop of healthy eating, of exercise, avoiding smoking, those things really, really get ingrained quite early. And so people should be paying attention from the time that they're children. But really, if there's a family history, check in with your physician as early as your 20s to start establishing a baseline, seeing what the blood pressure looks like, seeing what the cholesterol looks like, and determining whether this is somebody who needs aggressive diet and lifestyle modifications, somebody who just needs monitoring, or somebody who actually needs aggressive testing and interventions up front.
And what's the importance of brushing your teeth?
Well, there's a lot of good reasons to brush your teeth, but specifically, we do know that you can get some infections of the heart valves that can be associated with dental infections, which was actually quite a common way to get that. We also know that ongoing chronic, what we say ongoing infections in various areas, specifically the mouth and teeth, increase the risk of inflammatory response in the body, which accelerates the development of heart disease as well.
Any final thoughts, doctor?
What I would say is I know in these times, especially with the pandemic, a lot of people are really concerned about coming into the emergency room or going to see their doctor during these times with COVID exposure. And I would like to tell people that, if you're really worried that there's something going on with your heart, if you're having a worrisome symptom, you absolutely should not delay a trip to the emergency room or a trip to your physician. We are taking all the precautions that we can here to keep our patients and our staff safe. Everybody is washing their hands, wearing their masks. And so if you are having new or worrisome symptoms, don't delay a trip. We are concerned about people sitting at home having heart attacks or strokes or really worrisome symptoms simply because they're afraid of coming to the emergency room or catching COVID in the doctor's office. So I would say that especially during these times, because people with underlying health conditions can actually be at higher risk for COVID and things like that, don't let yourself get sick in any way. So whether it's COVID, whether it's heart disease, let us help you if you're worried.
Dr. Uddin, thanks very much. We appreciate you taking the time.
Thank you.
Scripps is consistently ranked by U.S. News and World Report as among the nation's best for heart care. If you'd like more information on heart attack symptoms and treatment, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks for joining us.